Hello and a warm welcome again to Moorgate Andrology. Now in today's video we're going to talk about penis filler, which penis filler to choose. And I want to make this video because I'm getting many calls in recent times asking me which penis filler is the best one to go for. So I thought it was about time really we sort of laid our thoughts down really in terms of Moorgate Andrology and our urologists, what we like to use, what we don't like to use, and how you should approach picking a particular penis filler for you. Now, first of all, I want to take you back about 8 or 9 years when penis filler first became available, which is not that long ago actually. We brought penis filler to the United Kingdom about that time. And I remember back then we were using only one product, and that product was Juvederm Voluma. Juvederm Voluma. And we used this product because Juvederm, I think it's fair to say, is a very high quality dermal filler that's used across the world. It's a tried and trusted brand. So we started out with this filler. And this was really important because apart from anything else, you want to be sure that you're starting and working with a high quality product. And also, the other thing to remember is that in the penis filler is used a little differently insofar as you're using far more of it than ever gets injected into the face. So, for example, you might be putting in 1 or 2 milliliters in these nasolabial folds here, or a similar amount to augment the cheeks if you're a bit gaunt in your cheeks and you want your cheeks puffing out. So, in much smaller quantities. But in the penis, you could be using anything between 10 and 20 milliliters maybe first time. So it's really important that we started with a quality product. And from there, we did try various, 1 or 2 other different filler products. And we always came back to Juvederm Voluma because of the results, because we trusted the product and because the results are really good. Now, this particular brand, Juvederm, and this particular one, Voluma, tends to give results that last around 12 to 18 months before you need a top-up treatment. That is to say that the hyaluronic acid breaks down naturally in the body relatively slowly over time. And after about 12 to 18 months with Juvederm Voluma, you'll be ready for a top-up treatment, which typically is about half the amount that you had in the first place, because when you come back to the clinic, you will still have some product remaining and it will just need topping up. Hence the term you'll hear when you do your research called top-up treatments. Now, from Juvederm Voluma, we moved on to another product which is not strictly a dermal filler, and this was a product called Ellanse, a very trusted biocollagen stimulator that's used widely, again to augment the cheeks and so on. Used far more in the face. Remember, again, this is used far more in the face than it ever is in the penis. And the early results with Ellanse were particularly good, it has to be said, as good as Juvederm Voluma. Our urologists liked the product, and so did our patients. However, Ellanse has one drawback, really, and that is that the lumps and bumps can sometimes be very difficult to treat. So when you've had penis filler, or in fact anything added to the penis, whether that be dermal filler or a fat transfer, there's always a small risk that you may get lump and bump formations as the product settles down into the penis shaft. Now, usually massage will break down these lumps and bumps, and you'll remain with good symmetry up and down the shaft. And your doctor or your urologist will show you how to do this massage in about the first 1 to 2 weeks. But occasionally, you may have a stubborn lump or bump form in the shaft that's resistant to massage. It doesn't seem to be going anywhere. But the great news is with hyaluronic acid, these lumps and bumps are reversible by injecting an enzyme called hyalase, which dissolves these lumps very easily. But with Ellanse, you couldn't do that. They can be treated with steroid injections, such as with Kenalog injections, to help break them down. And sometimes this works, but sometimes it doesn't. And in worst cases, the only way to remove these lumps with following the Ellanse is with a minor surgery, and that's really not what we want, because the whole point of having dermal fillers is that you can avoid having to have a surgery, and maybe you haven't got time for a fat transfer, for example. So although the results were good, our urologist took the view that the potential side effect of stubborn lump and bump formations wasn't really worth when we weighed things up, we didn't really want to continue. But around the same time, Juvederm brought out another product called Volux, Volux, and this is another hyaluronic acid. But the difference between this one and Voluma is that with Volux, the results can last up to 2 years. And I remember that this was about the time that we were having our deliberations about Ellanse, and our urologist took the view that if we had a high quality hyaluronic acid with good duration of around 2 years, why would we continue to use Ellanse? So we took the view that we would switch to using Juvederm Volux instead of Ellanse. That was purely our urologist's decision. It might not be the decision of some other doctors who may be still using Ellanse. It was just one that Moorgate Andrology took in their view and what they considered the best interests of the patients. So Juvederm Volux is a high quality, again, another Juvederm product, a very high quality product that has a duration of about 2 years. And I think it's fair to say now that around 90% of Moorgate Andrology penis filler patients will have Juvederm Volux. It does give extremely good results. 1 or 2 clinics claim that the results are quite firm in terms of the product. Hasn't been our experience, but of course, if it's theirs, that's fair enough. But the aesthetic result is certainly, in our opinion, very, very good. Now, the thing to remember, of course, with penis filler is that it's going into the penis in fairly large quantities. As I say, 10 to 20 mil, maybe in the first treatment. So it's really important that you find a penis filler that has good longevity. Good longevity. Otherwise, if, for example, it's only lasting for around 6 months, then the treatment just becomes too expensive. You need good longevity of the product. Otherwise, you need very deep pockets. So Juvederm Volux would be our preferred product of the moment. We do use, to a lesser extent, another filler which we like. We have to say, in our personal opinion, not as much as we like Volux, but we also use Perfecta, another hyaluronic acid filler, which we've had good results. But the duration doesn't seem to be, is not as long as the Juvederm Volux product. Now, one thing I do want to mention here is that we've seen certainly in the last 3 or 4 years a number of different hyaluronic acid products coming onto the market, some of which we haven't used, which is fine. Each practice will have its own preferences, and that's really good. But what worries us is that there are 1 or 2 products being used to augment the penis, 1 or 2 hyaluronic acid products, which are actually contraindicated for the genitals. And that really worries our urologists. We don't see why a product that's contraindicated for the genitals, which means it should not be used. The manufacturers have said our product should not be used in the genitals. Don't see why that product needs to be used in the genitals when others are available where there is no such contraindication. So our advice when you're doing your research is to be absolutely sure which product you are having injected. 1 or 2 other clinics do also make this advice very clear, and I think it's very wise advice that you must be absolutely sure which product you're having. And if it is a product which is contraindicated for the genitals, such as Genafil, for example, then we would advise that you give that very careful consideration. In this country, most penis filler is injected by qualified doctors. Here at Moorgate Andrology, by urology doctors. And this is really important because they have a deep understanding of the male genital anatomy. And I think it's fair to say that in the United Kingdom, there are only maybe 2 or 3 clinics that are best known for penis filler and have considerable experience in penis filler injections. Also, it's very important that after your penis filler, you follow the correct post-treatment advice. And this includes no sexual activity for about 10 days. This is really important because if you have sex too quickly, then you run the risk of moving the product around the penis and forming quite definitive lumps and bumps, and we don't want that. So avoid sexual activity for about 10 days. Do the massage that the doctor tells you and how he tells you to do it, and things should settle down quite nicely. And if you do have any stubborn lump or bump formations, don't worry about those. They can be treated with this enzyme called hyalase that dissolves them. So hyaluronic acid is a very forgiving product. So I hope that's given you some idea of what to look for when you are considering penis filler. They are now extremely popular in this country, and they do give very nice results in the right hands. Of course, I will finish by saying that at Moorgate Andrology, about 30 to 40% of our penis filler patients eventually move on to a fat transfer. And this is because although they like the results of penis filler, they want something more permanent at the end of the day. And that's fine too. And also the other way, some patients who have a fat transfer and like the initial appearance of the penis, remember after a fat transfer, about 30 to 50% of the fat does absorb in the first 8 weeks. You can have this topped up also with penis filler, with hyaluronic acid filler. So the two are often used interchangeably. Well, that's all from me today. I hope that's given you some insight into penis filler in the United Kingdom. If you did like this video, please do click the like button. And if you'd like to see more, please subscribe. Until next time, I look forward to seeing you back here at Moorgate Andrology very soon. Bye for now.